thank you again for joining me on the podcast. I am super, super excited to talk to you. So let's start with the first question. So you've had a long and respected career in hair restoration. So I wanted to know what first sparked your interest in this field.
Great, great question. When I was doing my dermatology training, which was in Philadelphia, I came across some articles written by a wonderful gentleman. He's a gentleman now. He was my age then, by the name of Dominic Brandy. And Dr. Brandy was publishing these articles in a journal called the Journal of Dermatologic Surgery and Oncology, which is a very commonly read journal if you're a dermatologist. Even plastic surgeons read it, hopefully. And he was doing this amazing operation where, if you know, when men get older or when they experience significant hair loss, they often lose the hair from the front all the way to the back, and they're left with sort of a horseshoe shape of hair in the back. Mm-hmm. So it comes from the back and comes around to here. Yeah. So they lose everything on top. So that's a pretty extreme form of hair loss. And what he was doing, and he had learned it from some people in Australia, the people in Australia were making an incision by the ear, coming up to the border of the hair on top, coming all the way or partly around, halfway, and they would lift one side of the scalp and they would dissect all the way down into the neck, and they would lift one side to get halfway across the scalp. Then they would come back and do the other side. Well, Dr. Brandy went to Australia to learn how to do this. It's an amazing story, which I won't go into the details, but Nick has tremendous, he's fearless. He got home and he did his first operation, I believe, on his uncle. Of course, you always want to do it on family members first. And he did it successfully, I believe, in his house or the basement of his uncle.
Oh my!
And it's a procedure where you can lose a lot of blood, but he managed to get through it. And then he came up with the idea of doing the other side at the same time, and it became known as extensive scalp lifting. So you could take somebody who had significant hair loss on top and literally undermine or release all the attachments of the scalp all the way down to the neck. If you feel down to where your neck, nape of your neck, past that, literally lift it all up like a helmet and cut out all the bald skin that you possibly could.
Oh, wow.
And you usually could get a person who was what we call a type 6 on the Norwood scale. You could get them down to almost completely closed in a lot of cases. And if not, sometimes you could just fill in with hair transplants to the other area. So I became fascinated, and he wrote several articles. I became fascinated with what he was doing because my background had been emergency medicine and internal medicine. Okay. And so from a surgical point of view, it really interested me. When I was doing my dermatology training, there was a conference that would go on every year, put on by a Dr. Galen McCulloch. And Galen was a cosmetic surgeon. I believe he trained as an ear, nose, and throat doctor. Very prominent institute in Birmingham, Alabama. And every year he would have this meeting and invite all these doctors from across the country to partake. And it was teaching. It was all about teaching. And as an anecdote, I believe that Galen McCulloch was on the same team as Joe Namath when Alabama won the national championship.
Oh, wow.
So Galen McCulloch was a football player.
Oh, wow.
And became a cosmetic surgeon.
Huh. Who would have thought?
Who'd have thought it? Who'd have thunk it?
Right.
So I wound up going to Birmingham for the meeting, and at the meeting was Dr. Brandy. And we met we were about the same age. We started talking, and he had this marvelous history. He had done an internship where he just rotated. He never did a surgical fellowship. So everything he learned by himself.
Oh, wow.
It was really
that
miraculous.
Is amazing, yeah.
And he had really wonderful surgical technique and great sense of aesthetics. And so we started talking, and I said, I've been reading your articles, And he wasn't a dermatologist, wasn't a board-certified surgeon or any of these things. I said, I've been reading your articles, and I'm really fascinated. And he said, well, why don't you come up to Pittsburgh, and I'll show you how to do it.
Nice. Very
Which
nice.
was extraordinarily kind.
Uh-huh.
So I got on the next plane I could, and I got up to Pittsburgh, and he started teaching me how to do the procedure. And then as it turned out, when I finished my training, which was, I believe, about a year later, he also had an office in Fort Lauderdale.
Oh, wow.
So he would
Very
do
cool.
some of his work in Pittsburgh, he did some of his work in Fort Lauderdale, and he asked me if I would help him. So I was living around Tampa,
Okay.
and I would travel from Tampa to Fort Lauderdale once a month or so, and we would do surgeries together. And he would do hair transplants as well. And from there, I started doing more hair transplants. I was doing other cosmetic procedures, eyelids, facelifts, a lot of liposuction.
Okay.
But unfortunately, in Florida, they made it very difficult for dermatologists to do these procedures without having surgical privileges at the hospital. Mm-hmm. So as it turned out, you couldn't get insurance. You couldn't get malpractice insurance very easily.
Got it.
So as it turned out, because I was doing so much hair, I started getting some notoriety for doing hair. And honestly, that's how I started.
That is awesome. Isn't it great how we can find sometimes people that help us throughout the way, and it's like I call them angels. So that is great.
I mean, he was a great mentor. Even though we were of the same age, he was very kind in allowing me to learn from him.
Exactly.
And I always mention him. He's one of the people who certainly I attribute to giving me my start.
Love it. That is amazing. Do you still talk to him or not yet? Or not?
Yes, I just got a Father's Day message from Dominic the other day.
That is amazing. Okay, and now touching, so when you started, you mentioned about like the initial techniques. How has that improved or changed throughout the years?
Yes, so I would say that there used to be a procedure called a scalp reduction. Mm-hmm. And so those have fallen aside. Was a way to try to remove bald skin as well. The extensive scalp lift was great, but unfortunately there were some problems with it. I was very fortunate. I never had any problems doing the surgery, but there were some issues that did arise, and it sort of fell to the wayside. And what took its place is what we call in the modern way of doing a hair transplant. Instead of doing scalp surgery, where you're removing a big piece of skin from the top of the head or from the sides, now you're just doing what's called follicular unit transplantation. So what happened was that myself, Dr. Bill Rassman, now from LA, Dr. Bob Bernstein from New Jersey, I believe Bob's retired, Ron Shapiro in Minnesota, the four of us were working sort of together, and we recognized that hair is in groupings. It was first described by a gentleman by the name of Headington, but we really didn't pick up on it until we started doing this surgery, where we recognized that hair is not in single hairs generally. Okay. Rather, hairs are in groupings, 1s, 2s, 3s, and 4s. In fact, I actually have a picture. I don't know if you can see it.
I see it.
So you can see this is a picture of a box, and you can see hairs typically are in 1s, 2s, 3s, and 4s. And so in the old days, where people like Biden and Trump underwent hair transplantation, Trump's all hair transplants. Oh, yeah, wow. Trump is all hair transplants.
Oh, cool.
He had that's why he has to wear his hair in such a peculiar fashion.
Okay.
So he had the old transplants, I suspect. And then he's tried to probably add to it to some extent. Same thing with Biden. He had the old plugs where it looked like doll's head of hair or cornrows. But this method that we developed changed everything, because doctors were doing 10, 20, 30 plugs at a time. Well, we were taking these grafts and doing what Mother Nature dictated, which is instead of taking, so if you look at this picture, what the plugs would do is they would take a bunch of these and you would punch this out like you were coring out a piece of grass to plug somewhere else.
Correct.
So they were taking these big multiple hair groupings together,
Mm-hmm.
and that's what made it look pluggy to some
Okay.
extent. And what we did is we just put back the way Mother Nature does it naturally, which is to just put back the actual groupings
Uh-huh. Mm-hmm.
one at a time.
Mm-hmm.
So the first time we got up to doing 1,000 grafts at a time, people were amazed. How could you?
Wow.
People thought it was barbaric what we were doing, but actually it's become the way of doing it.
Mm-hmm.
But what we were doing is, in general, we would take out a strip of tissue, like a ribbon
Mm-hmm.
of tissue, with these groupings in it, and then and the other thing that happened is that we were doing the dissection under the microscope, so it was
Okay.
much more precise.
Okay. Mm-hmm.
And that really started with a doctor by the name of Bobby Limmer in Texas. And Dr. Limmer was doing one grouping or one hair at a time.
Okay. Wow.
So we went from plugs to split plugs to what are called mini grafts, the micrographs, which were single hairs, and then eventually we got to what Mother Nature does, which are these follicular unit groupings. Now, today, you have two methods of doing it primarily. So one would be the more traditional method where you cut out a strip
Mm-hmm.
of tissue, what we call strip harvesting.
Mm-hmm.
It's also referred to as FUT,
Yep.
which is a really terrible acronym, follicular unit transplant. There are a lot of FUs that
Yeah.
you use, so it gets a little funky. The other method of doing it is called FUE, and FUE is follicular unit excision. And what you're doing with that is you literally take a device, and I'm just going to fix my screen here and get rid of some of this nonsense here. So literally you use a drill, and the drill has at the end of it a punch, which is just a cylinder,
Uh-huh.
and you literally try to punch out the individual grouping.
Uh-huh.
This one. But when you do it, you have to be very careful to try to avoid surrounding groupings
Okay.
that are too close together. Because the advantage of, I'm going to go backwards a little bit, the disadvantage of the strip technique is that you wind up with a linear scar.
Yep. Uh-huh. And I've seen it, yeah.
Right. So if you look at LeBron James, one of his problems is he's got a linear scar from having done that procedure.
Of course. Okay.
The advantage of the other procedure is you don't get a linear scar, but you do get little dots.
Okay. But
Okay.
you cannot tell a lot about those dots, right?
Well, if you keep harvesting, you can.
Okay, got
If
it.
the person shaves their head, and that's one of the misconceptions about FUE.
Mm-hmm. Okay.
And so my practice is 50% FUE, 50% FUT. And what people forget are the dangers of doing the FUE, which is that you can wind up over harvesting, and you can wind up thinning out the donor. You can also get these little dots, and if you sell it as a scarless procedure, that's really not correct. Every hole that you make is a scar,
Yeah. Okay.
and it usually heals lighter in color than the surrounding tissue.
Mm-hmm.
If you take grafts from adjacent to each other, the human eye can see those dots.
Okay, got it.
So if they wear their hair really short, you're going to see those dots, and you can try to do tattooing to try to cover it. The advantage of the FUE, and plus, when you do the FUE procedure, you have to go over a fairly large area of donor.
Mm-hmm.
You're spreading everything out. When you do the FUT procedure, if you feel in back of your head there's a bone,
Mm-hmm.
right? Feel that bone?
I feel it.
Right above that bone is the best hair you'll ever have in your life, especially if you're a male.
Oh, wow. Okay, I didn't know that.
If you think about it, when men lose their hair and they still retain that
That's the
pattern around the sides, they still have that hair for the most part.
Okay.
Almost every guy, even if they're extensively bald, there are exceptions, but most of them will retain that hair.
Mm-hmm.
That's the best hair you'll ever have in your life. That's why it's so good for transplanting, because it should stay for most of your life. So FUT takes advantage of the best hair you'll ever have. It takes less time to do and generally costs less money. So there are advantages and disadvantages to both techniques.
Of course. It depends on you to decide the pros and cons of what you want.
Correct. And, if you wear your hair greater than half an inch in length,
Yeah.
and you're older, you're not 20 and you're not trying to have a Vin Diesel kind of look, FUT can make a lot of sense.
Exactly. And of course, for women, well, anything.
Well, it's interesting you say that because there are some doctors who only do FUE, which I think is really not ideal.
Right.
I think to give your patient the best options, you should be able to surgically know how to do both procedures.
Correct.
Because sometimes you run out of tissue with FUE and you have to go to FUT, and vice versa. Sometimes you run out of tissue with FUT. It's great if you can go to FUE.
Correct.
But with women, often women are not great hair transplant candidates because they often lose their hair in a more diffuse pattern than men do. So sometimes, and because women wear their hair longer generally, FUT can make a lot of sense for them.
Totally. You wouldn't be able to tell.
Right? And interestingly enough, we're starting to see more and more women who are suffering from hair loss. I think it's maybe because they're more aware of it. I think it's always been there.
Maybe,
but
yeah.
Yeah, I think that women are more concerned now about dealing with menopause and premenopause. Women are much more, as you might expect, because women have one more chromosome than men do. You know, you have XX, we have XY, and the Y doesn't do anything really. You guys are so much smarter than we are.
Oh,
that's what I attribute it to. So women actually are much more complex, and when you have to deal with hair loss, they're more likely to have problems with thyroid, anemia,
a lot of hormonal stuff,
vitamin D problems, calcium problems, endocrine problems of various types, dealing with menopause and losing estrogen. So women are a lot more complex in terms of looking for hair loss. And that's one of the things I'd like to get across, is that when women are losing hair loss, I think that they should be evaluated. They should take the time to see a dermatologist, not just go for a hair transplant with anybody down the street or in a different city or wherever it is, but actually do the investigation. Make sure that your hair loss isn't because you have a thyroid problem or an iron deficiency. It can happen in men too, but far more likely in women. And unfortunately, I see a lot of women who were treated when really all they needed was a metabolic workup, or all they needed was supplements.
Do you find that now patients are becoming more proactive or more anxious or whatever feeling due to the online research and the information that's available?
Yeah, it's sort of a double-edged sword. So on one hand, I would say the vast majority of patients are much more educated. They come in usually with an idea of what they want, how they want it done. And sometimes that can be a little bit difficult to deal with because they're often stubborn about what they're doing. And sometimes you're trying to convince them of what's in their best interest, but they don't want to hear it. And then you have to decide if you're, as a physician, if you're comfortable doing what they want. But yes, people are significantly more informed. I think sometimes they get distracted by some of the stuff on the internet. And I would say that sometimes when I go on the internet, whether I'm looking for a product or I'm looking at a medical procedure or whatever, I often find that the people who are most vocal are unfortunately the people who are the most unhappy.
Yep.
You know, it's much harder to get somebody to put up a positive review than a negative review.
Yes, 100% with everything.
And so people need to take things with a grain of salt, and that's where the communication between the physician and the patient is so important. And the other thing that I would urge patients to do is, I know that you can do virtual consultations on Zoom or Skype or whatever. But if you're going to do a procedure like this, would you take your appendix out, meeting the doctor the day of the surgery, if it was an elective procedure?
Yeah.
I mean, would you go for heart surgery the day of the procedure and meet the doctor the day of the procedure?
No, I wouldn't. 100%.
I don't think it can be done, but I don't think it's wise.
I agree.
I think ideally you want to meet the physician face to face.
Yeah, I agree.
In the ideal circumstance. And if you're going to schedule a procedure that way, I think it's always a good idea to think about coming a day or two earlier into the office so that you avoid having to cancel the procedure because of a medical problem that you might have.
True.
You know, maybe they didn't know that you had high blood pressure, or you didn't know you had high blood pressure. Maybe you took a drug that you shouldn't have taken that's going to adversely affect the surgery.
Correct.
So if you come in a day or two earlier, you can figure out these things much more easily. So I really urge patients in the ideal world to meet with the physician face to face, whoever is going to do the surgery.
I agree. Plus, they need to see your scalp like in a very good way. I would think like it's not enough for me to show you like this like from a Zoom call. I think
Yeah, it helps, but it's not the ideal.
it's not.
And the other thing that people need to realize is, unlike a breast augmentation or unlike liposuction, um, after the operation, within a couple of days, you can take off the bandages and go, wow,
I see it.
you can't do that with a hair transplant.
Right.
It takes a year for that hair to grow in.
Exactly.
So it's a lot more stressful recovery period than for doing, let's say, a breast aug or a facelift or a liposuction, because the results are not so immediate.
Yeah, correct. That's another expectation that it's good to set with the patient beforehand.
Correct.
Yeah. This is a competitive space. The hair restoration right now is it has increased a lot. What do you think that sets a practice apart from the others?
I'd like to think that what sets a practice apart is, number one, experience, the education of the person doing the surgery. How much experience do they have, not just in doing hair surgery? How much experience do they have in diagnosing and treating hair diseases and hair loss in general? And I think a lot of it has to do with the technique being used within the office. Within the office, what are the quality control measures used in the office to try to maintain excellent results? I mean, unfortunately, you can't guarantee results in surgery. I'm sure you know that.
Yeah.
But you'd like to think that you have very consistent results, and that you're maintaining quality. And so I think therein the technique that's being used.
Agreed.
And I think it's better to have. I think I'm a little bit biased because I'm comfortable with all the techniques, but I think it's good to have a physician who can adjust if the situation requires it. So if you had a patient, this is less so now, but years ago when we were first teaching people how to do FUE, it was a very difficult learning curve for them to learn how to do it. That, in part, that's why the robot was so good initially, because some people had a difficult time learning how to do it. So there were times when a doctor might have to switch from FUE and say, the transection rate, the damage to the grafts is too much. We shouldn't accept this. We should switch to a strip technique. And so if the patient is okay with that, it's important that the physician know how to do the other technique. And then there are times, as we talked about earlier, when you've run out of space to do FUE, and you might want to do FUT. That might be a way of recovering more grafts for the patient and not thinning out the donor. So I think having diverse background in surgery can help a lot too, and in diagnostics.
Totally, being able to adjust to the situation in hand, that sometimes you don't know that it's going to present itself.
Correct.
Yeah. From your experience, how important do you think that digital marketing is to grow a practice or to keep a practice running?
I think today it's essential.
Essential.
I think it's hard to have a successful practice without doing a significant degree of digital marketing. Now, there are some practices where, because of legacy, of notoriety over so many years, and again, sometimes that's misplaced, but those people, their practices are so busy just based on name.
Correct. They don't, sometimes they don't even have space to bring in more people. They're already booked as it is.
Yes, you're correct.
Yeah. So without going too deep into business strategy, do you, in your practice, do you have involvement in the marketing decisions or not at all?
So I'm actually embarking on a new endeavor.
Ooh, okay.
So I'm actually joining a dermatology practice in late July, early August.
Okay, over there in California, right?
Yes.
Yeah.
And they have been kind enough to allow me to basically handle the hair side of their practices.
Uh-huh.
So I get to express my opinions strongly about marketing.
No, that's amazing.
I've done this for 40 years, so.
Because it goes hand in hand. Like a lot of the times, it's very good that the expert has a great communication with whoever's doing the marketing. Because sometimes the marketing can lose specific and very important details that are not being communicated in the marketing. And for them, like to me, they have to also become kind of experts to be able to know what they're talking about.
Yes, I think you're right. And, I think an area, as you might expect, like just picking out the right SEO words.
Yes, 100%.
Is so important. And that's where your expert should be able to provide you with keywords that he or she or whomever thinks is relevant to the site.
Exactly. And the right ones, and right away you should be able to review them and like, okay, yes, this person knows it. Like he's not going too broad. He's going very specific on what we need.
And along those lines, I see some people give over the website development or digital marketing over to the marketing people, only to find out that when it gets finally put up on the web, that they put misinformation up there.
Exactly. I've seen it a lot.
Inaccurate information.
Exactly.
And that's really destructive to a practice, in my opinion.
And not just the practice, but if they're maybe investing in advertising, they're also maybe not spending the dollars where they should be spent. And of course, that's waste of money and waste of potential growth right now and in the future.
And there are people who are well versed enough on the web, even if they're not physicians, to look at stuff, and they'll point it out to you. That's just not true.
100%, that's true. Well, thank you so much, Dr. Paul. This was very, very insightful. I learned a lot.